Legal and ethical issues in critical care unit. Introduction. Ethics have always been an integral part of nursing. Nurses, when they are working at all levels and the areas of the practice, experience a range of ethical issues during the course of their day-to-day work. And critical care has come to be associated with high technology, aggressive and often risk-filled medical care. And the critical care nurses are often confronted with the ethical and legal dilemmas related to various ethical principles, and it has increased dramatically since the early 1990s. And many dilemmas are byproducts of advanced medical technologies and therapies developed over the past several decades. Some of the ethical principles: first, autonomy, beneficence, non-maleficence, justice, veracity, fidelity. Legal and ethical issues informed concern. So concern problems arise because patients experiencing acute and life-threatening illness that interfere with the ability to make decisions on treatment or participation in clinical research. And the informed concern is based on the principle of autonomy. So here, as a nursing fraternity, we have to give full independence or autonomy to the patient so the patient can take the choice of decision. And the concern denotes voluntary agreement, permission or compliance. Legal and ethical issues informed concern. It implies to permission by the patient to perform an act on his body either for diagnosis or therapeutic procedure. And the four elements of consent are voluntariness, capacity, knowledge and decision making. Coming to the type of concern, it's implied consent and expressed consent. Expressed consent is nothing but a verbal written. And some of the points to be considered while getting consent: consent must be given voluntarily. If patient is not mentally capable, that is mainly critical patient is on ventilator, acute stage, the informed consent should be obtained from surrogate or legal next of kin. And it should be given by a person of sound mind and above the age of 18 years. So the children are not give consent. So we can't consider the consent from the children that is below 18 years. And it requires the disclosure of basic information considered necessary for decision making. So whatever the decision we are taking, we have to disclose all the information to the patient and the patient body. The patients providing consent should be free from pain and depression. When concern invalid, so some of the situation when we are taking consent, even the consent may be considered as invalid. So consent obtained from a minor that is less than 18 years, and consent given under fear, fraud or misrepresentation, and consent obtained from the person who is not fit, and consent obtained in language not understood by the person. So mainly we have to get consent by giving the consent with the same knowledge, whatever the knowledge that the patient is speaking, the same knowledge we have to speak out and make sure that the patient understood the thing. And the consent obtained from person under sedation, intoxication or semi-consciousness. Consent obtained without providing adequate information on the possible risk or invalid under law. Coming to the medico-legal case. Medico-legal case is any case where the discipline of medicine comes to help the legal fraternity in its discharge of duties. Interface of medicine and law is multidimensional and required complex or plexing. And healthcare professionals have to be very cautious in dealing with the medico-legal cases. And we had a request of the patient or relatives upfront for not registering the case as medico-legal should not be accepted, and the medico-legal case should be registered as soon as physicians suspect foul play or case brought several days after the incident. and the medical legal case is received in hospital by any case brought by police for the purpose of examination and reporting, and any case referred for expert management and advice. Here you can see following cases, some of the cases considered as medical legal case, and it should be intimate to the police regarding. So all such injuries and the burns patient, alleged cases of assault, all cases of suspected or evident of poisoning or intoxication, case referred from court. And cases of suspected or evident criminal abortion, cases of unconscious, comatose where it cause it's not natural or not clear, cases broad death, dead on arrival, sudden unexpected death, etc. Cases of suspected self-inflicted injuries or attempted suicide. The important consideration in medical legal case are notification to police, collection and preservation of samples, recording of dying declaration, etc. The important thing, that is medical documentation. The proper medical documentation is legal necessity. A good record should be correct, clear, comprehensive, chronological, contemporaneous, and it is the fact that good records are indispensable for proper care and treatment of patients. And concern from patients before carrying out any procedure is mandatory legal, ethical and moral requirement. Similarly, the document once prepared has also to be preserved for specified period of time. That is, mainly we have to preserve for 3 years from the date of commencement of treatment. Continuation of medical documentation. If any request is made for medical records either by patient or authorized attendant legal authorities, the document should be issued within period of 72 hours, and refusal to do so would be misconduct. The following medical documents are almost important as far as legalities are concerned: specialist consultation and referral slip, nurse's record, treatment record, temperature chart, blood pressure monitoring chart, intake output chart, operation notes, anesthetics notes, progress report, final diagnosis, discharge summary and follow-up notes, etc. as for a medical legal issues are concerned. Example, death certificate, medical legal reports, medical legal investigation reports, all are of immense importance and have to be very specific. Use of restraints. Restraints or intervention that limits a person's freedom to move. It can be physical or chemical. Research reported that the use of physical restraint can lead to skin trauma, muscular atrophy, nosocomial infection, constipation, incontinence, limb injury, contractures, depression, anger, decline in functional and cognitive state, and increasing agitation. Coming to the use of restraints, because restraints limit movement, they also limit autonomy. So considering the physical, psychological and ethical aspects of physical restraint, risk and benefits, it is advocated that such is only used when all other methods of managing the problem have failed. Employed with caution and as a last resort, and use least restrictive method possible. Decisions regarding life-sustaining treatment. Usually there are two levels of treatment considered, that is ordinary care, that is also we called as non-invasive, and treatment like providing nutrition, hydration and antibiotic therapy. And extraordinary care, mainly complex, it is invasive procedure and experimental treatments like CPR, cardiopulmonary resuscitation, advanced life support. So mainly we are supporting with the ventilator, defibrillation, and intra-aortic balloon pump and dialysis or any other therapies. However, the ethics believe that any treatment can become extraordinary whenever the patient decides that the burdens outweigh the benefits. So, In cardiopulmonary resuscitation decisions, resuscitation efforts are used to reverse the clinical sign of death, loss of spontaneous respiration, loss of cardiac function and unconsciousness. And ethical questions arise on use of CPR and emergency cardiac care. In what situation should resuscitation efforts be used? How long should efforts continue? A generally accepted position is that resuscitation should cease if the physician determining the efforts to be futile or hopeless. According to American Heart Association 2000, healthcare providers may stop CPR when 30 minutes, that is even adult or child, or 15 minutes in newborn form of advanced life support have been attempted without restoration of heart rate and breathing. The do not resuscitate order is still not documented legal practice in India. It is a verbal communication between the clinician and the patient's relative or caregiver. The autonomy of the patient also remains a weak concept. The law is silent or ambiguous on most issues related to end of life care. The financial status of the patient appears to be the deciding factor. In most cases, healthcare expenses are entirely borne either by the patient or by the patient's relative. Withholding or stopping resuscitation efforts is ethically and legally appropriate if the patient or surrogate have previously made his preferences known through advance directives. So if the patient or surrogate are given any concern not to resuscitate or withhold anything, if you are having a legal documentation, then we can go through it. Withholding or withdrawal of life support. So withholding refers to never initiating a treatment, whereas withdrawing refers to stopping a treatment. So it is entirely different. Withholding is we are not at all starting the treatment, just we are withholding. Withdrawing, just we are stopping whatever the patient receiving the treatment. The distinction between not starting a treatment and stopping it is not itself of ethical significance. What is whether the decision is consistent with the patient's interest and preferences. Ending treatment for sound moral reasons does not violate professional obligations. Healthcare professionals may find it emotionally more difficult to withdraw a treatment than to withhold it. On the other hand, it is often important to start a treatment to evaluate whether it works until a diagnosis is confirmed. It is better to start the treatment and later stop if it is ineffective. Decisions to treatment at the end of life are often difficult and best made after careful discussion between the healthcare professional and the patient or surrogate. The nurse ensures that the patient or surrogate understands the information by clarifying technical terms and helping the patient weigh treatment options. The patient then considers his or her own values and wishes in the context of prognosis and realistic options. And the final decision reflection, the patient wishes should be supported by the nurse and other members of the healthcare team. So whatever the patient wishes or the surrogate wishes for any spiritual practices, everything we have to give respect and we have to do the proper arrangement. The nurse is morally permitted to refuse to participate in withholding or withdrawing treatment from the patient as stated in the section 5(4) of the Code of Ethics. And the points to be considered: withdrawal of life support is indicated if the patient has Glasgow Coma score is less than 5, absence of pupil and motor response 3 days after arrest, and communicate frequently throughout the critical care stay, not just when death is imminent. So whatever the patient status, we have to inform the relatives ongoing. We can't say that suddenly and we can't declare the patient is dead. Provide consistent, honest information. Keep the discussion on withholding, withdrawing life support based on patient wishes and the burden versus benefits of the various options. Recognize that the patient and family are anticipatory grieving and provide support. Most decisions regarding withdrawal, withholding of life support are not made in courts. It is made based on open communication with patient, family, and surrogate as appropriate. And coming to the organ donation. Despite the success, there is severe shortage of organs to meet the demand. And the potential donor may agree, if they are agreeing to donate organs or tissues, so we can finally proceed signing a donor card, but final consent for donation by the patient, family or surrogate is needed before transplantation. So if they are giving consent to donate it, we can further proceed. And the removal of organs can be accomplished without causing significant harm to living donor, or organ removal are performed only in donor who meet the legal definition of brain death. Everyone has the right to donate their organ or tissues. The important ethical principles useful in decision making on transplantation include: we have to respect for persons, autonomy, beneficence, non-maleficence, justice and fidelity. And the critical care nurses are in a position to act as the link between potential organ donor and organ transplant recipients and point out the need for critical care nurse. So as we are a critical care nurse, we have to point out the need of the organ donation to the patient, those who are in brain death, their surrogates or relatives. We can explain to them based on the need of the organ donation. And the cost versus outcome, an ethical issue. The cost of intensive care treatment is very expensive and time consuming. There is much debate today in both the nursing literature and popular press about whether the outcome from intensive care treatment offset the high cost of prolonging life using technology and scientific knowledge. Ethical issues of most concern. The 5 most frequently used ethical issues are: protecting patients' rights and human dignity, providing care with a possible risk to your health, example TB, HIV, violence, and respecting and non-respecting informed consent to treatment, staffing patterns that limit patient access to nursing care, use of physical, chemical restraint. The combined analysis of reports revealed the following as being the most personally disturbing issues faced by the nurses: that is, staffing pattern that limited patient access to nursing care, prolonging the dying process with inappropriate measures, working with an unethical, incompetent, impaired colleague, providing care with a possible health risk, not considering a patient's quality of life. And ways to resolve ethical problems in critical care nursing. First, gather the relevant facts and identify the decision makers and stakeholders. Identify the ethical problem that is involve others in the process and use consultation resources as appropriate. Third, analyze the problem using ethical guidance and resources. Fourth, deliberate about the action alternatives in light of guidance. Choose one and justify the choice. Fifth, evaluate and reflect. Thank you.